Welcome to this short video. I'm Ted Jedinak. You're about to discover 5 super skills that maximize clinical outcomes for your MSK patients. Super skill number 1 that maximizes clinical outcomes for your MSK patients is: when it comes to your patient's feet and legs, the skill of assessing joints and range qualities is essential, particularly when it comes to tricky MSK conditions, because it's crucial to identify which anatomical structure is influencing the element of your patient's joint motion. Without a careful assessment of your joints and range qualities, you could end up sheet creep before you know it. For example, if you were to dorsiflect your patient's ankle and it had a wooden feel quality, meaning it was bone meeting bone, your clinical reasoning would be very different from an ankle that had a spongy, soft tissue end range feel. That spongy quality is suggesting fluid or fat tissue is influencing the end range limits. Your clinical reasoning would tell you that you need to investigate and manage those fluid or fat elements first, wouldn't it? That would be very different from managing a bone-on-bone end range quality, wouldn't you say? For sure. And then what if your patient's ankle demonstrated muscle stretch end range quality, or a ligamentous or capsular end range quality? And what if the end range quality was painful, or was so painful that your patient wouldn't even allow you to take the joint to its end range? Can you see how critical assessing your patient's end range quality is? When you're skilled at assessing the end range qualities of your patient's joints, your clinical reasoning for treatment options becomes really fine-tuned. Until you have the skill mastered, it's like listening to an out-of-tune violin. Can you imagine how terrible that'd be? Geez, playing the violin is hard enough without it being out of tune, right? And when you're more confident about your clinical decision making, this confidence also flows to your patients. It's the difference between listening to a beginner violinist and hearing a confident master. What a massive difference, especially when you assess and treat patients in ways that no one else has done before. This dramatically increases your reputation and standing in your community. This is why we've created the new online course that helps you master the skill of assessing your patient's joint qualities. And it's completely free. Simply click on the link on this page and start developing your super skill number 1 to maximize your outcomes for your MSK patients. Hey, even if you think that you've gotten end range qualities handled, check out this free course, because if you just pick up one pearl of wisdom, another patient stands to benefit. As a wise mentor said to me, Ted, you can't learn less. Always grab the opportunity to learn more, especially if it's free. Okay, that last line was my addition. The next super skill, which is number 2 of 5, will be coming to you soon. So start working on your end range joint quality skills, super skill number 1, so that you can maximize the development of super skill number 2. Thanks for watching this video. It's truly great to work with practitioners who want to maximize their skills so that they can help more patients like never before. Until next time, serve with spirit, consult with care, and check more joints today.